to speed up this warming process. Flip off the plastic-colored cap from the vial. Peel back the blister pouch and remove the SmartSight needle-free vial access device by holding the white Luer cap. Do not touch the spike tip of the access device at any time. Press the spike tip of the SmartSight access device through the vial's rubber stopper until the device clicks into place. Swab the syringe connection point, the blue circle, of the SmartSight access device with an antiseptic. Open the syringe by breaking the seal of the white cap. Twist off the white cap from the pre-filled syringe and remove it with the rubber tip cap inside. Press the syringe tip into the blue circle of the SmartSight access device and twist it in an easy, clockwise motion to make sure that the syringe is securely attached to the white Luer cap of the access device. Hold the skirt of the SmartSight access device so that it doesn't spin while you're attaching it, and to keep the syringe and SmartSight access device properly aligned. Inject the syringe containing the diluent into the vial. All of the diluent, 2 milliliters, must be used for suspension of the microspheres. With the vial and syringe still connected, hold the plunger rod down with your thumb and shake it vigorously for at least 10 seconds. When properly mixed, the suspension should be uniform, thick, and have a milky color. The microspheres should be fully dispersed in the liquid, and there should be no dry particles on the vial wall. Do not store the vial after reconstitution, or the suspension may settle. Invert the vial completely and slowly withdraw the suspension from the vial using only the syringe provided in the dosing pack. Make sure that the entire content is drawn up into the syringe. Label the syringe using the tear section from the vial. This is to clearly identify the reconstituted dose and dosage strength. Unscrew the syringe from the SmartSight access device by slowly twisting the syringe counterclockwise. Discard both the vial and access device appropriately. Peel the blister pouch of the Needle Pro device open halfway. Grasp the sheath using the plastic peel pouch. Attach the Luer connection of the Needle Pro device to the syringe with an easy, clockwise twisting motion. Seat the needle firmly on the Needle Pro device with a push and clockwise twist. Do not use the safety guard until after the product has been used, because it is not removable. Prepare the patient for injection. You will need to mix the Risperdal Consta once again, because the suspension will have settled since reconstitution. Shake vigorously back and forth for as long as it takes to resuspend the microspheres. Ideally, Risperdal Consta should be used immediately after suspension in the diluent, and must be used within 6 hours. Pull the sheath away from the needle, but avoid twisting the sheath, or the needle may be loosened from the Needle Pro device. Tap the syringe gently to make any air bubbles rise to the top. Remove air bubbles from the syringe by moving the plunger rod carefully forward, with the needle pointing up. Inject the entire contents into the upper outer quadrant of the gluteal muscle. Alternate between buttocks for subsequent injections, but always in the gluteal region. Never administer Risperdal Consta intravenously. After injecting the medication, use one hand and press the needle against a hard, flat surface to snap the needle into the orange safety guard before discarding. Discard the needle appropriately. Do not use the safety guard until after the product has been used. To avoid needle stick injuries from contaminated needles, do not intentionally disengage the Needle Pro device. Never attempt to straighten the needle or engage Needle Pro device if the needle is bent or damaged. And avoid mishandling the needle protection device in a way that could allow the needle to protrude from the needle protector sheath.